Perfect. All right. Well, thank you all for joining us today. This is the actual first meeting of the business and industry sector of the Kansas City Physical Activity Plan. And we're happy to get this sector started and are happy you're here to give us your feedback. So today, I just want to walk you through really what we're hoping to get through and some of the tools that we're going to use to do that. And then I'm going to let Missy and Tanya take it away. Natalie and I are going to be your backup support for the day. Feel free to scan this QR code here. What we're going to do is we're using a tool called Menti, which is really kind of a polling tool. We're going to use that to review the National Physical Activity Plan strategies for the business and industry sector. We use the national plan as our model. You've heard me say that multiple times. So what we want to do first is just get an idea of what those strategies are and react to those strategies by ranking them. What we're going to have you do today is really rank in terms of how important you think those strategies are in terms of being done. Like if you were going to do them in order, what's the order you would do those in? As we move through our conversation today, we're going to shift to using what's called Jamboard, and it's one of Google's products, and it's an interactive, online whiteboard. So it allows all of you to click through the link and type in your own feedback, and it allows us to save that feedback for future use and future conversations. We'll go through each of the different strategies. We'll talk a little bit about each one. Is it being done? Who can implement it? Are there barriers to implementing it? Who might be missing? And then we'll also go through what we call a prioritization matrix. So that's trying to determine which ones might be easy to accomplish in the short term and which ones might be important but harder to accomplish, and which things just may or may not be all that important. So we're going to start here with the Mentimeter poll. And again, then we'll shift over to Jamboard for more conversation. All right, Natalie, I'm going to have you walk us through the Mentimeter.
First off, did everyone have any problems logging on? I can go back to the directions page if you weren't able.
Yeah, if you will.
I don't have a cell phone. We're good. I left that at home today. So.
I can go back to the screen. If you, on your browser, type in that website and then enter the code, you can do it on your browser too.
Oh, perfect. Okay.
You must have had a really quiet day today if you didn't have your phone with you.
Yeah. Well, my daughter is sick, so she's at home with my husband.
Oh.
I've just turned 2-year-old and she woke up and couldn't open her eyes. They were so encrusted shut. So that was an experience for us.
Yuck.
But all right, I'm good. Thank you.
Then you can read those strategies on the right and then just put them in a ranked order list on which is your number 1 and then your number through number 5. Once you get them in a list, you can there's arrows to the right that you can either move it up or down to if that's easier.
Is that all the results, Natalie? Nope, still coming in. Has everyone had a chance to submit their ranks? Or their priorities, I guess? I haven't seen strategy one
so.
move from the top. It seems to be number one. So is that the final ranking? It looks like they stayed in the same order that they are in for the national plan.
It did look like that, yeah.
Yeah.
Any thoughts on those strategies from you all as you took a look at those? Do those seem to make sense?
Yeah, I feel like the data can be a really important piece on the business case, but sometimes you can have a lot of data and it's not gonna, change what they do, or are people gonna read it? So I think it's an important component, but it can be a sink sometimes if it's not. Sometimes you just can't make them care.
Well, there is the behavior change aspect at the end of that. So you've got the data, but we still have to change our behavior. So that may tie into exactly what you're saying there, Grace. That's a good point.
Mm.
And it does look like the fourth and fifth strategies of the national plan are really those that are related to data. So the last one is about surveillance. So that would be capturing the data. And then the other two are really looking at any evidence that might exist and how do we create clear and concise messages and disseminate that in ways that make sense. Okay. Any other thoughts or comments about that ranking? Anybody want to share any thoughts about why they left them in the same order, or why the surveillance might be at the end, or the well, let me just pause. Any thoughts on that? Comments?
I was just about to ask if we could have them pulled back up on the screen for us all.
I guess it makes sense because it's like a national kind of thing, but for strategy 5 with the physical activity and public health professionals, what kind of people or organizations would that look like in Kansas City? Or do we know that? Yes, do we know that yet?
Yeah, that's an excellent question. And that's going to be one of the questions that we ask as we get into the Jamboard discussion related to that. And so I think a follow-up to that we can bring back up as we get to that one is it's a strategy from the national plan. And so in this, it's talking about monitoring physical activity in U.S. workers in U.S. workplaces. Now, Kansas City is in the U.S., so it falls into that. But is that at some point we'll be discussing, is that a strategy that we want to do or can accomplish on a local level? And then if so, Grace, exactly what you're asking, who would do that? Or is somebody already doing that? If not, who would do that? And then are they at the table? If they're not at the table, we should probably bring them.
And then 2 and 3 are technically tied. Am I seeing that right? Strategy 2 and 3.
Like it.
Or is 2 above 3? Like based on the length of them.
I think they're tied.
Yeah. Okay.
So probably equally as important, or okay. Well, let's go ahead and shift over to the strategy conversation. So in this portion, we're going to break down we're going to focus on each of the strategies individually. And since we sort of ranked them in the same order as the national plan, we'll go ahead and review them in that same order as well. So Natalie, if you will drop that link in the chat. Oh, looks like it's there. Everybody can just click on that Jamboard link. Natalie is also sharing her screen as we talk about it. Tanya, I'll let you guys take it away.
I like how everybody's referenced anonymous Wolverine, anonymous Goose, anonymous capybara. Do you see that up at the top?
I don't quite know which one I
I
am.
don't even know what picks that. Yeah, that's crazy.
That's got to be, Natalie's got to be the PA plan. Here, I'll start typing something in and figure out what I am.
How funny.
You're the Wolverine.
Yep. That's too funny. Okay, so do we want to start with the strategy one? Businesses should provide employees opportunities and incentives to adopt and maintain a physically active lifestyle. Do we feel like this is already being done?
Oh.
Currently?
I think so.
And go ahead, Lacey.
No, I think, you know, for the most part, I certainly can't speak for every business, but from what I'm seeing in this chair and getting to work with various organizations throughout the KC Metro, I think it's certainly a priority.
I would agree.
I agree with
I
that.
think if anything, maybe some of the smaller organizations haven't either don't have capacity or haven't made it as much of a priority, but I feel like a lot of the larger ones across the board have.
Yeah. So being done where resources and manpower are available and like capable.
I mean, I feel like when you get into smaller organizations, it's kind of just good at it and some aren't prioritizing it. And then I think too is the difference between like allowing and supporting when employees create their own opportunities versus like providing those.
Yeah.
I don't know if all of you are familiar with Jamboard, but you have the option to go in and type these in yourselves if you want to add anything.
Natalie, will you show them really quickly how to edit those?
They should just be able to double click on them and it comes up.
Great.
Save.
Do any of you know of any organizations that are not implementing opportunities for employees to be physically active?
I mean, how would you define an opportunity?
Yeah, that's a great question. I mean, I would
Yeah.
say something supported in some way by the employer.
Mhm.
I know a lot tie it into their benefits in some way anymore with you know, something as simple as like cost of gym membership covered or different activity programs that may have kickbacks or incentives attached to them. But once again, those, you know, are bigger companies that can afford that tier of benefits to offer their employees.
Just as Parks and Rec, we do a variety of things together, whether it's like a walk at lunch or, you know, something like that. I'm curious because I don't live in a world that is fully remote. I'm curious to know what employers are doing for their employees that are mostly remote. Is it packaged in with their benefits for the most part? Are there other additional things? Does anybody work remotely that could speak to that?
Well,
We don't
I
have, go ahead.
go ahead, Tanya.
We're a hybrid
Uh-huh.
workforce, so we don't have many that are fully remote. If they're fully remote, they're like 100, 150 miles outside of an office in which I think is probably 20 people or less. But we do a variety of things. So we do have gym pass So a discounted gym membership option for those that are not in the KC Metro to use the Wellbeing Center, as well as if they just prefer a different option, they can utilize that discount. As well as through our insurance, there's 2 other options that are offered that are a really discounted rate to associates. And then we do a lot of like virtual lift and learns, lunch and learns stuff that's housed internal under my team to try to help those that are hybrid, or once again, are kind of our big thing, our off-site locations that aren't anywhere near us. How can we help and really benefit them? But they're not 100% hybrid by any means, or sorry, remote.
It's definitely an evolving and newer, I feel like, branch of our industry that's getting a lot more meat and potatoes added to it. Where you see a lot of employers looking to support those at-home workforces that you didn't necessarily see as much of before. And I know with like our clients, we have options of, you know, on-site, hybrid, and fully virtual support for employees, but it's once again, I feel like something that a lot of companies are looking to increase what they're able to offer their employees in that area.
And so what's the barrier to that, Missy? Is it mostly cost?
I would say, you know, it's a couple different things, getting them connected and engaged, and you know, that face-to-face has a lot of value with like accountability and support that it's harder to get remote, but you can engage with them in that manner. And then sometimes there are additional costs. Like our company has a full app that clients can opt into that has all sorts of support on there, but that is an additional thing outside of like on-site services. But then those on-site services oftentimes are trying to do things to reach both the hybrid, the remote, and the on-site teams as well, just to make sure that they're encompassing all of their sites as well.
Have you seen that a lot of the incentive is, you know, time off? For example, you know, just within my organization, if you log however many, you know, fitness days or minutes or whatever, then it equates to half a day or a day off. And we see that with Corporate Challenge too. We have various companies that will ask, you know, if we have a report on who all was involved, because it would make them eligible for time away if they're in a certain category of involvement.
Yeah, I definitely see that with Corporate Challenge oftentimes. I would say more often with activity level kickbacks I see are incentives around, you know, like giveaways or the benefits kickbacks that you get occasionally with movement goals. Tanya, do you see any other?
We have like a portal that we use that our watchers connect to it, as well as there's courses over like balance, mental health, you know, nutrition, all the above. And if they earn like the max tier points, they can get $180 in terms of like unlimited gift cards, you know, Amazon, whatever is all on there. We do a lot of that. That's a big incentive for to associates. The other thing is we pay for portions of local races. So we've got a list of about 37, and we do this for our offsites as well. They choose about 5 to 6 races there. And then Garmin will pay a portion for each individual that races. And so that's been, I mean, based on the company we are, that's a great way that our associates really like to be benefited or supported because they utilize their products. A portion of them being physically active goes towards that. I think if, you know, you can hold like leagues or tournaments. That's another big one that we have. And now we have a well-being center on site. Prior to that, they would pay for offsite rentals to allow a Garmin team to go compete against other organizations. But yeah, the portal is probably a good one because it allows associates to meet their needs. It's unlimited in terms of the content that's there. And so they can go about it throughout their whole year, using those resources, learning new stuff, being physically active to earn their points.
Yeah, I've seen companies in the past cover race costs as well, and that's always a popular thing.
Your
Yes.
local race planners love that.
Yeah. Has anyone else witnessed barriers?
I think some of the barriers go back to Grace's point. You know, you can't make somebody want to do this, but having the data available to try to influence their decision, I think is important.
So when you're talking about data, Lacey, are you thinking like return on investment data?
Yeah, and
Employee level data, how many absentee days?
Yeah, one of those strategies on the previous that we chatted about was, you know, working with the scientific field and the professionals to gather some of that data. And I think, to be perfectly honest, I think some folks just are unaware of some of the realities. And so I think working that strategy into the mix becomes important.
Some of that education components, just
Yeah.
educating the public.
We live in the health and wellness world, right? So a lot of this kind of seems like almost common sense because we've just been in it and around it for so long. I think some of the things that we do kind of just consider to be common sense might not be for everybody.
Yeah. Well, and you know, especially in recent years, everyone's people are such habitual creatures. And routines and work-life routines for many have turned upside down a few times in the last few years with the variations of work schedules of, you know, working from home versus on site and hybrid and back again. And so, yeah, I think anytime that habit gets disrupted, you have to almost give a moment to reset it and re-engage with it. And adapt it. And that can be a bigger challenge for some than others. So yeah, kind of re-engaging with them and supporting during those changes and those big life change moments.
Are you guys seeing that a lot of businesses and organizations actually have on site a wellness or fitness opportunity? Or, I mean, I know, you know, getting discounted gym rates and memberships is certainly a benefit, but nothing can really replace the opportunity to just go across the hall or whatever it is, you know, rather than having to travel to a gym either before or after work.
Yeah, and I think there's, I mean, immeasurable value on having those on-site services and those on-site expertise to assist and support, and to have those on-site centers that they can, you know, work into their workday, and they're having a crazy day, but they need a few minutes away. I mean, it's proven time and time again, getting away from your desk helps to refocus and re-energize, and people are more productive at work if they, you know, have those little breaks, just those brain breaks.
For sure.
Yeah.
I think there's also drawbacks to keep in mind too, though.
Yeah.
As we have learned along the way, there are several associates that are not comfortable working in front of other associates. And so that's I think at the end of the day, the costs and everything outweighs having an on-site, especially if everyone's in one location. For us, where we have several locations, it doesn't help, a large portion of our associates that aren't in KC Metro and can't utilize the Wellbeing Center. But then again, there are those that just are not comfortable or feel like they have to lose 20 pounds first before they can work out in front of other
Yeah.
associates. Which you never want that to be the way someone feels, but at the end of the day, there are just people like that. And that's where that alternative gym option or reimbursement has been super beneficial to those, to keep them engaged and moving, and not just like, well, I don't feel comfortable using the local one, so I have no options. I just won't, go to a gym or do anything.
Yeah, and I think adding to the overcoming barriers is anytime, especially with remote, that you can create opportunities of connection and FaceTime, even virtually, is so valuable in helping those folks overcome some of those barriers that we've been listing and help implement those, lifelong habits and changes.
So it sounds like overall, businesses are implementing this strategy right now. They've got employee wellness programs in some way, and you've already discussed and given great examples of the variability in the types of opportunities and incentives being used. And so I just want to make sure since this isn't exactly the area where I sit, we've mentioned benefits. So the benefits department is who might be implementing these opportunities and offering incentives. Are there any, I assume benefits are all going to sit within HR. Are there any other, I don't know, I guess groups that could be implementing this either within a business or, one of the things that's coming to mind right now and making me ask this question is insurance programs. So is an employee wellness program written into a contract with an insurer, like the rate from the insurance company is going to be better based on the number or quality or breadth of offering for employee wellness or employee well-being opportunities? I don't know if that does.
I can't speak to that, but I do know we get a wellness stipend from our insurance company to use towards these programs. So that's part of, we are well-being and benefits. So I know that portion of it, and I'm the one that does the budget for that portion, but I don't know the rhyme or reason to how or why that ties specifically to our benefits, but I know it's to our insurance. It's our insurance company paying us a portion to utilize on well-being programs.
Yeah. And I do know that some insurances do take into consideration these types of offerings because studies show that typically employees are healthier. They take less sick leave, they, overall, and there are benefits to that. So I do believe insurance companies take that into consideration when they're putting benefits together for companies. I also added leasing agents in there, leasing companies that are leasing office space, looking for ways to draw in folks. And then I would say, that might go along with like facilities teams.
Hello, this is Michelle Carmichael.
Hi, Michelle.
I'm with Blue KC. So as part of having our insurance, the health and wellness program through Blue KC is just part of having our insurance. So it's included as part of it.
Perfect.
So it doesn't
other-
affect the premium in any way. It's just all
Right.
included in all of your programs or all of
Yes.
your
Yes,
coverage
so
options.
they all get access to a healthier you, which they can utilize points that way, and that's up to the company to decide if they want to require points and things like that. But they have access to be able to track their fitness, nutrition, weight management, HRA, all those things,
Okay.
It's wonderful.
and discounts through different. So there's Blue 365, which is another discount portal, if you will. So if you have Blue Casey insurance, you can sign up using your membership ID, and then you get access to discounts on like 10,000 different gyms, fitness centers around the country. Acupuncture, chiropractic services, things like that, you get discounts and different fitness items.
That's incredible. And such a good support tool and resource for people. Do you feel that do you see that often with competitors as well, that they have some, maybe not as robust, but some sort of a program similar to
Yes.
that?
Yes,
Okay. Perfect. So,
just a different variety, but
okay.
several of them, it's an upcharge in your benefits if
Okay.
if you want it to be included. Not all, but some.
Thank you for that insight.
You're welcome.
Yeah. That's helpful. Okay. Oops. So do you think we've covered enough for this strategy? Are we ready to move on to the next one? This is great
It's-
conversation.
I did want to ask, is there anyone under the who are we missing? Is there anyone else that we need to include?
Do we have anyone from benefits right now?
Not at this time, to my
Okay.
knowledge. Tanya,
I run up under benefits, but no, they have kind of their own team of 5 that handles all of that.
Yeah.
We overlap a little bit, but
so it'd be
Okay.
good,
not a lot.
yeah, to include some additional benefits representatives.
Okay.
Wonderful. All right, do we want to, any final thoughts, or are we ready to move into that next frame? All right, let's go ahead and shift on to strategy 2. Businesses should provide employees opportunities and incentives to adopt and maintain a physical active lifestyle. Oh, whoops. My screen didn't shift. Sorry about that. Businesses should engage in cross-sectorial partnerships to promote physical activity within the workplace, and such efforts should extend to local communities and graphic regions. There we go.
So I think this goes to like the races.
Yeah.
How organizations are, I think,
I mean-
So I think in terms of, is this being done? I think corporate challenge is also
I
a
was
good
gonna say-
example of a cross-sectoral
Mhm.
partnership of how this is being done.
Being done in a big way.
Yeah.
Yeah. Leagues, you mentioned that, Tanya.
I also think some of the opportunities, like with the healthcare partners, bringing mobile units on site to do
Mhm.
annual screenings, that's a big partnership.
Mm-hmm.
So is that the healthcare partners? Yeah, there it is. Health screenings. Yeah, okay.
Yeah.
Other races.
Who can implement, who has control over power to implement.
Well, and I think, your gyms, if they're offering a discounted rate, a lot of times that is because the gym is able to give that discounted rate to the organizations.
Yeah. Folks that implement this, I would say, are your wellness teams can implement these solutions.
I think gyms can too. So for instance, Lifetime has a Tuesday run that's open to anyone. You don't have to be a member. And then KU Medical used to, they might still, I'm not sure. It's been a few years since I worked there, but they had like the first Saturday of each month, they did a strength and training program that was open to public too, free of charge. You could come do the workout.
Yeah.
Very
And I
cool.
think some of the local hospitals, I know North Kansas City does some different things to support local businesses and physical activity with them. So local hospitals, Parks and Rec, perfect. I'll put one that has local hospitals and gyms both on it.
I'm writing healthcare one right now.
Oh,
I know when I worked at the Y, the North Kansas City Hospital would come and do health screenings.
that's exactly the what I was thinking about was how they'll do health screenings and they do different like wellness classes for the public that you can attend virtually or on site, and several different community outreach initiatives. I was gonna say fitness teams, gyms. I would say even like HR and your like HR benefit teams. I've seen.
On that same note, Missy, I think, the very top, the administration, if they are, leading by example, I think that's big on implementation as well.
Yeah. And coming from the top, I mean, it really helps support and set that culture within the company. That's a great point. I would say barriers to success could even be like funding. If companies can afford to implement some of these things.
Well, and individuals.
And individuals, yeah.
I also think individuals could go beneath who can implement, because if you don't have their buy-in, you're not going to be doing any of it.
Yes. Love it, Lacey.
Well, I mean, if you have a wellness department that's willing to pay for corporate challenge, but you have nobody interested, that's not going to happen.
Right. Yeah. Transportation could be
yeah, that's a good one.
a barrier.
Kind of a catch-22 on this one. We were talking about, having a positive company culture. On the flip side, if you don't have a good culture, that could also be a barrier.
That culture and that support, that sense of it's okay to go on a run over your lunch hour, or it's okay to do a walking meeting or things of that nature.
Mhm.
Yeah, 100%. I would say a lot of policies, yeah,
Incentives.
and corporate buy-in.
Mhm.
So across sectors, in terms of cross-sectoral partnerships, how do you overcome barriers? Like if the barriers are funding, how do you work together to overcome funding issues or overcome company culture or
For
Mhm.
funding, I think utilizing each other's resources, right? So, something we try to help our offsites with, because they don't have as much of a budget because they're a much smaller location potentially, is do you have a local college that has an exercise science program? I will tell you, students for experience would love to come teach you a free lunchtime class so they can write it on their resume, and then you in exchange get that free class. So I think finding the right resources, sharing those resources across the board would be super.
Yeah.
I think prioritizing, because you might have people that are interested, but this could be something that is pretty easily backburnered, right? Because it's usually a benefit to create these partnerships that then create opportunities for employees to be physically active. So I think prioritizing that this is just as important as anything else that's happening within the organization is going to be one way to overcome.
I think educating
Mhm.
the different businesses about those resources available to them and the partnerships available to them. Sometimes they don't know the benefits of that cross-sectorial partnership
Mhm.
and why it can help with some of these barriers that they might be running into.
Then who are we missing?
Mm-hmm. I think still that like HR benefits rep.
I think some of the places that might be missed in this are those that are really experiencing staff shortages. Because again, they're just trying to get the job done, right? They're not going to have the manpower to facilitate working with partners in the community when they're just focused on having enough people to get the job done.
I think that's a great point, especially even if it's not a staffing shortage, but just a really small organization. And we're talking about, wellness and HR folks, and this may not be really our target audience, but not all companies and organizations even have a singular HR person, let alone a
Sure.
wellness person too.
Yeah.
So I think I keep going back in my head to the communication. So I think communication is a big
Mhm.
part of it. So communication, then understanding the value. So the chamber does an excellent job of communicating information. Like they get it out there. If you notice in your inbox, there's lots of great updates that come on a regular basis. Okay, so the information is being compiled and put together, but I'm confident there's a gap between it getting sent out and it getting into, or it
Mhm.
getting opened.
Mhm.
And so and then there's also the groups that aren't members of the chamber. Okay, so how do you get to those groups? So in terms of communication, what are some of those things that are like, what are we missing from that perspective? Maybe not necessarily who, but maybe it's not that. Maybe businesses do have adequate knowledge, but they're missing other things in terms of funding,
Mhm.
motivation, culture, priorities. Like Lacey, you were just describing, you got to get, like in the healthcare setting, you got to take care of the patient,
Yeah.
Mhm.
even in a staff shortage. So I got to take
Yeah.
care of the patient. So anyway, I just bring that up to think about, are there other things that we're missing or who are missing?
So within regards to communication, do you have someone specifically in mind as to who we are missing to bridge that?
No, I was just thinking about the chamber, and I think they do a great job of getting information out there. But if you aren't a member of the chamber, like for example,
Yeah.
I'm on the chamber listserv because I'm involved in the workplace wellness action team. I'm not on it because I'm Children's Mercy's representative.
Mhm.
Mhm.
Children's Mercy is a large organization, and that membership is maintained through a totally different department, and they could care less about me. I find that information extremely useful, and it
Yeah.
helps me get a better picture of what's going on and what businesses are worried about right now. But like Natalie doesn't get it, and how many other people don't get it and don't get
Mhm.
to see that information. So in a business like Children's Mercy with over 8,000 employees, 8,000 of them aren't getting it. You know what I mean? So
Yeah. Yeah. So how do we take that or something like that and push it to the masses?
yeah, and where? Like
And where?
where do we do that and how do we do that? Now that's not necessarily, that might get us, anyway, I throw that out there because at some point we'll get to the tactic conversation here.
Mhm.
And I just want to, maybe we'll circle back around to that when we start thinking about tactics for this.
So
Yeah.
social media might be, I think in today's age, a huge influence to others.
Mhm.
There's a way to do that. For instance, the Wellness for the Win, I know she partners with several local small upstart companies that have utilized her and I'm sure provided her some form of free content or resources or whatever that looks like for her to get this information out about their business, right? Because her following is so large, she hits thousands of people with one post or 5 posts that
Mhm.
she's expected to do over a series of 3 months or whatever that looks like. So I think just the day and age we're in, social media is such a huge push, which I think not as many organizations or different companies or whatever that looks like have actually gotten fully on board with or want to avoid for other great reasons.
Mhm.
I think too, there might be, as we're talking about the chamber, and obviously not everybody's a member of my chamber, but there might be an opportunity to work with other regional chambers and really make a focus on diversity. We have some great, like the Heartland Block Chamber and the Hispanic Chamber and the Asian American Chamber. So as we get more into that, like how do we disseminate information? I think just spreading the net wide.
Yeah, that's a
And
great point.
if you have anyone, if you're a chamber member, and you have anyone that's not on the mailing list that you would like to be, you can always let me know. And as long as you remember, I can add whoever you want to that mailing list.
Thanks, Grace. Great point. I'm thrilled to see so many examples of the cross-sectoral partnerships that already exist here in the area.
Mm-hmm.
That's really promising.
Oh, I see we're at our time today. I just wanted to see.
Going fast.
Okay, it was
Oh my gosh.
or if we wanted to stop.
Um, how's
What do y'all
everyone
think?
feeling?
Felt like that was productive. I feel like we also have a lot more to do.
Do we feel like we could get through one more? I don't know what your schedules look like today, everyone.
I'm able to stay.
I'm good for one more.
Lacey,
Yep. I can do it.
Grace, you get everyone else okay?
Yes.
Okay, perfect. All right. Strategy 3, professional and scientific societies, adding extra syllables there, should create and widely disseminate a concise, powerful, and compelling business case for investment in physical activity promotion.
Yes, it's being done. So I say this because we brought in some national speakers
Mhm.
talking exactly about this. So a couple of the in 2012, for example, in the medical journal Lancet, they had a supplement dedicated specifically to physical activity and why physical activity is important and why people should be involved and how to improve it, how to improve rates of physical activity, reduction of chronic diseases, review of evidence, etc. So again, that was in 2012. The National Physical Activity Plan continues to work on this. They have I think it's the CDC provides physical activity recommendations. They've updated
Mhm.
those, I think as recently as 2018. I may be getting my dates for different recommendations mixed up, but they've
Yeah.
updated physical activity recommendations for the population, let's see, I'm trying to think. We've got some information on the return on investment
Mhm.
for employees that have better health.
Yeah.
Um,
I would say like you have your governing bodies in this industry, the ACSM, you have URSA, IDEA, WELCOA, all of those groups that are consistently funding research and pulling data together of research that's been funded to share with those in our industry.
Well, and I'm sure, Michelle, you can speak to this better than I can, but I would assume a lot of the insurance benefits are based off of scientific studies and the benefits of physical activity.
Yes. I don't know what else I could add, but it is all based on scientific data.
Mhm.
Yeah.
So insurance incentives.
Mhm.
Again, with who can implement, I think that's employers.
Yeah. Administrative, oh, go ahead.
Well, I'm thinking, and this is probably helpful to have this part of the conversation, because I'm thinking about this from a who can implement, who can create and widely disseminate the concise, powerful, compelling case for physical activity, investment in physical activity. I'm thinking it's the professional and scientific societies that are creating that, and then the businesses then implement the strategies like
Mhm.
1 and 2.
Universities,
Sure.
Yeah, that's
research,
another.
yeah.
Mm-hmm.
Oh, yep, healthcare organizations, universities,
There's also a National Wellness Institute.
mhm. And even just like, it might be easier to say our wellness and fitness organizations, just kind of umbrella
Probably.
it to include URSA and all of them.
Mm-hmm.
Because there, I know are quite a few out there.
So in terms of barriers, I'm going to ask a couple of questions. Do we think the barrier is a lack of information?
I
Do we have a compelling business case to make?
would say barriers to success is almost an abundance of misinformation, maybe.
That's a good one.
There's a lot of confusing and contradictory information around
Well, and to be perfectly
physical
honest,
activity and
propaganda.
yeah.
Yeah. Mm-hmm.
And some people just get so overwhelmed by it.
Mm-hmm. Yeah, I agree.
And so I think is that access related to access to the information, like to the business case?
Oh yeah.
Yeah, I would think.
Mm-hmm.
Excellent point on unqualified experts.
There you go. Yes.
Yeah, memberships are definitely can be occasionally like that gatekeeping of you have to have that membership to get to that access of information. It's a good one. Whoever put that in there. And sometimes it's just I'm not really sure what to put in the box, but the how. I read this. Now, how do I implement this in my life or my workplace? That bridge of the article to the how.
The implementation piece of it.
Yeah.
Mm-hmm.
And that might even fall under overcoming barriers is communicate resources on the implementation strategy, strategies for implementation. I've seen some governing bodies that have started doing free, like access to a free webinar, seminar for a short period of time. So communication of those opportunities could be a good way to overcome.
I love access to free webinars and stuff because, we are in a organization that is very focused on continuing education and that sort of stuff. But the reality of it is we budget to fund those opportunities. So anytime that I can push out something that I see to be a quality opportunity to my staff, I'm going to do it. If it's free, absolutely.
Yeah.
Online, I like that. That's fantastic because we've found, online can fit anybody's schedule.
Mm-hmm.
Okay, I just typed this one up. I don't know what you guys think about that.
Yeah.
Oh, yeah. I like that.
On that same vein, I think education surrounding, how to identify what is reliable information and what is maybe just one of your social media experts.
Mm-hmm. Under who are we missing? I would love to see someone tied with like a university.
So I will
Looking at
mention that
this.
Dr. Herda or Ashley Herda from KU often will come in and speak on these sort of topics or try to persuade organizations as to why, investing in this is so important. And she's at the Edwards campus. So she is local up here. Her husband's at the Lawrence campus, I believe. But I know they do spend time in, when asked, will come in and speak at different organizations or events or whatever that looks like.
I love that.
Yeah, does she want to join us?
Yeah.
She might, yeah. I know that you can also request like lunch and learns through her. I don't know if there's a fee or
Okay.
not, but she'll come and talk on different lunch and learn topics for associates as well.
Oh. That's great. I love that she's local.
Yeah.
Any others that we're missing when we look at this? Mm-hmm.
I'm just wondering how we can really adapt this to Kansas City specifically, because I don't think we're going to have a lot of representation from these professional and scientific societies here locally. Or
I think we
I don't
can.
know. Okay.
Yeah, they exist. They are around. So for example, Robin is a representative from ACSM. John Tifo is a researcher at the center that is active, I think, in ACSM and some other areas as well. I'm just thinking about those that are own center, but I know there's more at KU Med. I know there's, like Tanya just said, representatives from KU that might be there on the Edwards campus. There's more from the Lawrence campus. Their department, it used to be health, physical education, recreation, and dance. I don't know what it is anymore, but there are groups over there, researchers, so they can fill a number of hats: researcher, representative from university, and then professional societies as well.
Mm-hmm.
In fact, they're hosting the regional ACSM meeting in Kansas City at Children's Mercy, I think in March. So it might not be bad to get in front of the group of local people that are attending to just help identify who among them is actually working in this area of employee wellness that might be able to help us advance implementation.
Perfect.
Okay.
Okay. Any final thoughts on this strategy? No? Any final thoughts on the three that we've talked about? Any discussion points within what we've discussed today that we'd want to go back over with you all before we wrap up here?
Did we already have our next meeting set?
Yeah,
I-
so go ahead, Shelley.
No,
I
go
just
ahead,
put
Missy.
the registration in the chat for the next
Natalie.
meeting.
Yeah, so I do want to thank everyone for joining us today. Our next meeting is, correct me if I'm wrong, Natalie, December 11th at the same time, correct? Okay. That will be over Zoom again, and our goal will be to be finishing out these strategies with what we've gone over today and moving into 4 and 5.
And I don't think we've planned anything past then, have we? The 11th.
We,
I don't know if you want to start looking.
I think we're doing that second Monday of the month.
Yeah,
Perfect.
second Monday at 2:30, correct?
Yes.
2:30 to 3:30. Wonderful. And once we wrap up strategies for these 5 strategies, we'll begin to move into our tactics and outlining those as well.
Natalie, did you happen to set up the registration for the other meetings, so January, February?
Yes, I did.
Great. And as a reminder, so in order to make these as, I guess, as easy as possible to get on your calendars, we have Eventbrite registration set up for all of them. The Zoom link will always be included in there. We encourage you to reserve your spot so that you can add it to your calendar automatically. But we're not sending out meeting invites separately, simply because we want to encourage others to attend. And if we send it out only via Outlook or something like that, we would potentially miss other people and miss giving them an easy opportunity to sign up. So feel free to sign up for the other meetings through our website, Kansas City Physical Activity Plan.org. You can go onto the upcoming meeting sections and you should be able to see all the meeting dates and go ahead and sign up for those to get them on your calendar early. Feel free to forward it on to anyone else you think might be interested in joining us. But thanks so much for all your feedback today and staying a little bit longer.
Yes,
Thank
thank
you,
you.
everyone.
Thank you.
Thanks.
Have a